And I want to start with one terribly important point. And if you remember nothing else of our discussion today, I want you to remember this. We have a lot of senior citizens in the room. Many of you, I'm sure, rely on Social Security or Medicare. So I want to be very clear about one thing. Whatever you hear from the government, from the Democrats, from the Republicans, there are no plans on the table in Washington that would cut the benefits of current Social Security and Medicare recipients. I want to touch for a moment on the Ryan plan. You've heard a lot about Congressman Ryan, my colleague from Wisconsin, his plan, which was part of the Republican budget. And I'm going to try to give it to you as fair as I can, as factual as I can. When I tell you my opinion, I'm going to tell you it's my opinion, because I do have an opinion on it. Congressman Ryan, first of all, I give him credit for helping us make the discussion about the future of our country's fiscal situation a little more honest. A year ago when we were talking about our debt and our deficit, we were talking about earmarks and foreign aid and just cut those. Hey, we should talk about those things. Less than 1% of the money that we spend every year, so it's not what we need to talk about. So Congressman Ryan, I'm giving credit for at least bringing Medicare, having the courage to bring it into the discussion. Because as I told you, down the road, we got to make some changes so that it's there for me and my kids. I don't like his plan, and that's obviously my opinion, and I'll tell you why. And here's what his plan does. His plan would change the Medicare system from the kind of guaranteed system that it is right now. All of you have a doctor that accepts Medicare. Hopefully we'll get more rather than fewer of those. We can talk more about that later. But that doctor prescribes medicines, asks you, to get x-rays, go to the hospital. The Medicare system pays all that stuff. They pay that stuff. Congressman Ryan's plan is that you would, it's called premium support. And I'm going to give it to you straight now, just the facts. Congressman Ryan's plan would, starting, not probably with almost anybody in this room, but starting with anybody who was born after 1957. I may be one of the few in the room. In other words, younger than 55 years old today, when I get to be 65 and qualify for Medicare, instead of having this kind of guarantee plan that we have right now, I would get a voucher from the government, premium support. And I would take that voucher to the private health insurance companies and I would purchase health insurance with that voucher and with whatever other monies would be necessary to purchase whatever plan I wanted to purchase. That's the fact. Opinion. One of the reasons there's two reasons why I don't like this plan. One is that the idea here is that having all of our seniors going to the private insurance companies and buying insurance is going to create for a more competitive insurance market. Now that may be true. I suspect that more competition, I was a supporter during healthcare reform of interstate competition amongst health insurance companies, and I do suspect that more competition with our insurance companies would probably, lower our costs a little bit. But the reason healthcare costs are growing is only very small, or only partly because of inefficient insurance companies, if you will. Underneath this growth, we have a model, a business that is pay by the drink, fee for service. Doctors and hospitals get paid for each and every procedure, diagnostic test, prescription, etc. that they do. They have therefore an incentive to do more. The system sets them up to do more rather than to do efficient things, getting paid for outcomes. Now, don't get me wrong. I'm not saying that doctors or hospitals are corrupt or anything. I'm just saying that economic incentives matter. And that's the way the economic incentives are set up. That's a big reason why we've got constantly growing. And by the way, there's some really good reasons too. Who ever heard of an MRI 30 years ago? We get new technologies, new drugs that cost billions of dollars to develop, and somebody's got to pay for that. Here's the thing. Healthcare inflation for decades has grown at 3 times the rate of consumer price inflation, 9, 10, 11, 12%. And you see this in the premiums. If you're paying premiums for private insurance, you see this percentage growth. So what happens is, over time, that voucher becomes less and less of a total chunk of what the insurance companies have got to charge me because of the difference between consumer inflation and medical inflation. I don't like that. The CBO, the Congressional Budget Office, which is bipartisan, nonpartisan, estimated that this is going to shift about $6,000 of costs onto each and every one of our seniors. So, look, I'm proud of Ryan for bringing this into the discussion. I told you I didn't like his plan. We can talk more about it. At the end of the day, I'm not going to shout about Ryan. I'm just going to say, look, it just feels a little bit lazy to me because he solves the federal government's problem by shifting the risk onto our seniors. That growing cost is going to be on our senior shoulders rather than on the federal government's shoulders. So all of a sudden, we're not, as a federal government, in trouble with the Medicare unfunded liabilities costs, but our seniors are bearing that burden.